opening remarks, and we'll move right through our press conference today. Mr. Mayor.
Thank you, Chief. I don't have much to say other than we are enacting a joint executive order this morning. The chairman and I, we need to understand that many retail businesses will be closed, and I want to assure the business community these are not measures we've taken lightly. I'm convinced that the sooner we take comprehensive action to arrest the spread of the virus, the sooner our community will return to normalcy. I am concerned. We are getting calls. There was a food truck on Slappy yesterday. People are congregating. I don't think folks are taking this threat as seriously as we should. The coroner has got on this podium and he has explained people are dying. The medical professionals have told us that this is a highly contagious virus. We can't wait until we are infected to stop the spread. Make no mistake, there are several hundred people awaiting test results. It is very likely that as many as 500 people in our community are already infected with the virus. In this executive order we are enacting today, there is a provision. People who are tested are frequently released from the hospital. They are instructed to remain at home. We are getting information that some of these people who have been tested are not following those instructions. Please understand that you are putting friends, neighbors, others at risk when you get out of your home until you know that the test results are negative. There are also people who are actually positive, who have either been released from the hospital or were not admitted because their symptoms were not sufficient to justify hospitalization. These are the figures we had this morning. On the 18th of March, there were 69 patients in Phoebe Putney who were confirmed to have the virus, or what the professionals call persons under investigation, or individuals who are believed to be positive. That was on the 18th, 69. This morning, we had 101. A matter of great concern is that Phoebe Putney is approaching its capacity. We cannot be out infecting people in the community. We have to let the medical professionals take care of people who have cancer and leukemia. Most elective surgeries are being postponed. This is an emergency. Make no mistake. So what we are doing is, again, imploring people to remain at home. This order is coming out. Many businesses, many retail businesses, barbershops, beauty shops, you're going to be closed. But let us be clear. We want to take action sooner rather than later. We want to do more rather than less so we can get back to normalcy as soon as possible. Thank you, Chief.
Thank you, Mr. Mayor. Christopher Cohelis is the chairman of the Dougherty County Commission. Mr. Chairman.
Thank you, Chief. Agree with the words of the mayor. The shelter-in-place order is extremely serious. We need to take that to heart. If you don't have necessary business in the community to do, you need to be at home. You need to be at home with your family. You need to be with your living unit and not congregating with other folks. We've also had many reports that a lot of folks have been carrying on large cookouts in their neighborhoods. That is counterproductive. We need people to stay within their family units so that this disease does not continue to spread. I agree with Mayor Dura. We are taking drastic and swift action now in order to prevent the economic fallout and the strain on our resources that will inevitably happen if we do not suck down these measures at this point in time. This is very important that we do this to slow the spread of the disease. We know that we cannot stop it from spreading, but we can slow its spread, and we have to be very conscientious that we have a limited number of resources in this community, and we cannot have a run on resources that is unnecessary or that that frankly prevents others from getting the care that they need. That is very, very important. The mayor and I have issued a new order today, which the mayor mentioned. It ratchets down the amount of restrictions that we have that will be preventing certain businesses from operating. I'm a business owner. I understand. It has been hard on me. It's been hard on many others, but this is done in order to prevent us from engaging in business with services that aren't necessary. Many retailers will still be able to operate, but it will be in a different fashion. Some are going to have to get creative in terms of curbside pickup, online orders, drive-through, and things of that nature. Again, we also encourage our citizens to continue to support your local businesses and to order takeout, order gift cards, do those types of things that will that allow you to still support your local businesses. Additionally, a copy of our order will be given to medical staff at Phoebe so that each and every citizen who has been tested for COVID-19 and who is discharged is made explicitly aware of their obligations, not only as citizens, but under law that will be in effect as of 6 o'clock this evening, and already having the law that we had already previously enacted that makes it very clear that if you have the virus or you are suspected of having the virus, that you are to self-quarantine. This is a very serious matter, and we have to take on this responsibility to treat others with respect and to acknowledge that even though while you may not be symptomatic in a way that is devastating, that if you do infect another person, it may kill other people. We know that we have 7 confirmed deaths here in Daugherty County, and we are awaiting the tests of 6 other individuals who sadly have passed away, and we don't know yet whether or not those are related to COVID-19. We have a large number of tests that are outstanding, and I also want to emphasize this. This is not just a Daugherty County problem. We are receiving a lot of folks here in this community at Phoebe Putney Memorial Hospital that are from other counties outside of Daugherty County, and they are experiencing the same things that we are as well. And while we've had an experience of a hot spot here in Daugherty County, we know that we are the leader in industry and business and retail for this entire region, and many of the folks that live in surrounding areas have come here and also become infected with the virus. So that's why it has been paramount to myself and to Mayor Duro that we reach out to local city mayors and county commission chairmen. We're going to be starting, hopefully by Tuesday, a regional task force to address this issue, and I will continue to call upon my colleagues in a respectful and diplomatic way that those in surrounding counties also recognize that it is incumbent for Southwest Georgia's future that we all adopt aggressive measures to deal with this now, rather than there being such a run on our resources that we can't respond. We need to do these things now in order to be able to survive longer and stronger and make sure that we don't have a run on our resources that puts us in a crippled position. Thank you.
Thank you, Mr. Chairman. Michael Fowler is the Daugherty County Coroner. I'd like to ask Mr. Fowler to come up for some comments. Mr. Fowler.
To God be the glory. To God be the glory. To God be the glory. I would like for you, along with myself, to take a moment of silence for the lives that have been lost during this time, the families that have been affected, the one that's in quarantine, the first responders, the medical profession. This team, we put a lot of hours in, losing a lot of sleep. So if you don't mind, let's have a moment of silence. Thank you. because we're going to need God to help us through this. This is something we have never dealt with before, but we're going to need God. And given my stacks, I will be giving the stacks for Dougherty County. Dr. Russo will give the stack for the rest of the district. In Dougherty County, we have had 3 there from Phoebe Putnam Hospital residents in Dougherty County. Those are the ones I would give residents in Dougherty County. We've had 2 from the nursing home. We had 1 from the resident. So we've had a total of 6 residents of Dougherty County that has died. We have another 6 waiting on the test results to come in. So until we get those test results, we had a person that died in the nursing home this morning. So people are really dying. I'm a pastor myself, but I like to encourage every pastor. I met with my congregation and encourage them, as the mayor said and the chairman said, we got to encourage people to stay at home, stay off the street, keep your distance, wash your hands, all these rules. We need to follow those rules. So, pastor, I know you have influence over your congregation. We need you to come to the table to help encourage your members to do the same thing. Until we all come together on the same page and the same table, this virus is going to keep on spreading. Like I said, until you go to the hospital and start walking those hallways and see those people in there, people that you know, and it's people of color, of our color. So it's sad to see that, but we got to do something. So I appreciate you for your time. Thank you.
Thank you, Mr. Fowler. Dr. Stephen Kitchen is the Chief Medical Officer for Phoebe Putnam Memorial Hospital. I'd like to ask Dr. Kitchen to come up, please.
Good afternoon, and thank you, Chief. I would like to begin by absolutely echoing the sentiments that you heard expressed by Mayor Duro and by County Commissioner and Chairman Cohilas as well, in terms of to really curb and reduce the transmission of coronavirus, of COVID-19. It absolutely requires the personal responsibility of every citizen of Southwest Georgia. No question about that. Because as you have heard, we are aware of people who have tested positive for COVID-19 who really need to be in self-quarantine at home, who've not been abiding with that recommendation. And when you don't, there's no question you are submitting friends, family, loved ones to an unnecessary exposure risk there. So, I would like to begin by imploring everyone to abide with the recommendations that you've heard in terms of social distancing, avoiding social gatherings, and certainly if you have been tested, if you're either what we call a PUI or someone who's tested positive, to self-quarantine in accordance with the guidance and recommendations that you have heard before. I will provide an update at this point. So as of this morning, across our health system, we've had a total of 103 patients who have tested positive for COVID-19. Roughly 100 of those have been at Phoebe Putnam Memorial Hospital in Albany, and the other 4 have been at Phoebe Sumter and Phoebe Worth. Of that 103, 38 remain in the hospital and 59 are at home. In addition to that, we have an additional 78 patients who remain in our hospital who have pending tests at this point, who again are what we refer to as persons or patients under investigation. We've had a total of 95 negative tests. So I think what you're seeing at this point is that COVID-19 is very prevalent in our community, and we are actually having more people who test positive for the virus than test negative at this point. We have had a total of 6 deaths. You heard yesterday we had 5. That 6th death is actually a patient who expired on March the 16th, but we just received notification of their positive test today. So although that number has gone from 5 to 6, that's actually a patient who expired back on March the 16th. We have had a total of almost 900 people who have been tested at this point, and again, about 700 of those still have tests that are pending at this point. One of the most promising things that I will share with you, and I think this was certainly, kind of a leading story on all your typical news outlets this morning, is that the FDA has just, effective today, approved a test that many hospitals will have the capability to do in-house. And fortunately, that will be the case at Phoebe Putney, and we anticipate probably within a 2-week time frame, we will be able to offer testing for COVID-19 in-house. That is going to dramatically change the landscape in terms of patients who are awaiting test results, because if we can do this test in-house, probably within a matter of hours, we'll have the results of those tests. So patients who are still in the hospital pending test results, patients who are at home, who are self-quarantined waiting the results of the test, I think this will be a significant alteration and be able to put us in a better position to really concentrate our efforts where they need to be. Every morning we have what we call a state of the house report, and it goes through what our overall hospital census is, and on each floor and so forth. So I will tell you, as of this morning, and this is solely for Phoebe Putney Memorial Hospital in Albany, we had 97 patients who are currently in the hospital who have either tested positive for COVID-19 or who are still awaiting test results. In comparison, we have 80 patients who are in the hospital for illnesses that are not thought to be COVID related. So the point I'm trying to drive home is, based on the pattern that we're seeing at this point, we're actually devoting and allocating more of our resources, more of our staff, for providing care for those patients who either have COVID-19 or are suspected of having COVID-19. I will also share with you, in terms of resource allocation and what's required from a care delivery standpoint, it requires probably 3 times the number of resources to care for a patient with COVID-19 as opposed to a patient who does not. And the reason why is, all the staff has to have all the personal protective equipment, all the isolation procedures have to be in place. These patients really require a lot more to be cared for, particularly when they're in one of our intensive care units. So there's no question that we have to be mindful in terms of the resources that are required, and make sure that we're not overtaxing the resources of our facility. And I think probably nothing underscores that more than the fact we currently have 38 ICU beds at Phoebe Putney Memorial Hospital. We have 12 beds in what we refer to as our medical intensive care unit, or MICU, 12 beds in our CCU, or coronary care unit, and 14 beds in what we refer to as our surgical intensive care unit, or SICU. We were trying everything we could not to commingle patients with COVID-19 with patients who are in our surgical intensive care unit for obvious reasons. Those may be patients who have recently undergone an open heart procedure, other very significant surgical procedures as well. Became very apparent that due to the influx of COVID-19 patients and the number of COVID-19 patients who were requiring ICU care, that we were going to need to utilize that surgical intensive care unit for that purpose. So again, I think what I'm going to tell you illustrates what we're seeing across the United States in terms of demand for ICU capacity. So what we have done is basically stood up a fourth intensive care unit at this point. We have taken what we refer to as our post-anesthesia care unit, or PACU, and basically are turning that into a fourth ICU at this point. So what we're going to do is move the patients, non-COVID patients, who are currently in our SICU, and they will now be housed in our PACU, or what we used to refer to as a recovery room. I will tell you, I think this is indicative of the commitment of our employees and our medical staff at large, because we have a very, very dedicated team of physicians, nurse practitioners, nurses, pharmacists, respiratory therapists who care for the patients in our 3 intensive care units. Well, our surgeons have come to us and said, we will take care of those surgical patients in our PACU because they know that our ICU staff is going to be very overextended at this point. And I will tell you, that's the spirit, that's the esprit de corps that is evident every day. Obviously, our hospital is not dissimilar to every other hospital you're seeing at this point in terms of, we know our resources are going to be taxed. I think, you know, this is something that evolved after Hurricane Katrina, is that hospitals have, for what I refer to as a playbook, and it's called the Crisis Standards of Care. So when when we're in a situation where we know our resources are going to be overextended and taxed, when there is a surge capacity that typically would go beyond what we would normally see, we have a playbook, we have a plan, and we have already begun to implement that. And what that means is we look across the spectrum and we say, how can we best allocate the resources that we have? So I think probably an illustration that I will give you is, if you look at this fourth intensive care unit that we're going to stand up, rather than that unit being solely staffed by intensive care nurses, it may be staffed with an intensive care nurse working in conjunction with a nurse in the post-anesthesia care unit, working in conjunction with one of our critical care physicians, and one of our heart surgeons or trauma surgeons, as well as some of the nurse anesthetists that we have. What I'm saying is we will reallocate those resources in a way that will best meet the needs of patients in our community at large. You know, lastly, I do want to speak to the fact that, you know, I think it's hard to convey what I have observed over the last week. Again, when I walk in one of our intensive care units, one of our nursing units that is caring for COVID-19 patients, the degree of teamwork and collaboration and commitment. because I think it really speaks to the underlying values of our workforce and our physicians and our organization at large, is that people unite around a common purpose. And I'll just say, I've never been prouder to be a part of our medical staff and our medical community, and to proudly represent Phoebe and the organization that I represent before. So, you know, I think we all look at what can we draw from a sense of inner inspiration, and there are certain quotes that come into mind, and one quote that I always shared with my kids that I have always loved is a quote by Martin Luther King that says, the ultimate measure of a man is not where he stands in times of comfort and convenience, but rather where he stands in times of challenge and controversy. And I think that's as applicable to a person as it is to an organization, as it is to a community at large. And I think we all acknowledge in times of adversity, we have to draw upon the strength of a higher power. So thank you.
Thank you, Dr. Kitchen. Dr. Charles Ruiz is the director of the Southwest Georgia Health District, and will receive report now from Public Health and Dr. Ruiz.
Thank you, Chief. I too would like to go on the record as saying that I have observed a great deal of teamwork and commitment and dedication in this community, and I'm very impressed and pleased with it, and very inspired as well. And the public health team is pleased to be a part of that effort, and to also work in collaboration with other parts of the community. So this morning when I checked on the Johns Hopkins website, as many other people have done, I saw that in the United States they're listing 347 deaths from COVID-19 virus. And it's probably a good idea to realize that a significant portion, probably the majority of those 347, have either comorbid conditions such as chronic lung disease, serious heart disease, serious kidney disease, or diabetes, or they are part of the elderly in our community, or both of those. And one reason why it's so important, I think, to bear that in mind is we should all be careful day in and day out with everything we do. But especially when it comes to those folks in those categories, we really have to wash our hands more and keep our distance more, and do all we can to protect those individuals and to assist them, particularly when those folks need something that has to come from the community. It would be wise if those folks could stay at home where it's relatively safe, and it would be good if the rest of us could offer to run some of those errands for those folks who are at highest risk. You've heard Mr. Fowler this morning give the report on the number of deaths of Daugherty County citizens to COVID-19. I would like to report on the remainder of the Southwest Georgia Health District. Amongst the other 13 counties, there have been 5 reported deaths from COVID-19. There are 2 citizens from Terrell County, one from Early, one from Lee, and one from Mitchell. And those numbers are about 3 hours old. And this is a changing situation. Whatever we report in that regard today is certainly going to be changing as the week progresses. I want to talk a little bit about some things that are happening in the world of public health. One thing we've talked about, particularly Chairman Cohilas has talked about some help that we are getting from the CDC. So as of yesterday, we have one person here now from the CDC who is probably going to spend the entire week with us. And she is a very bright and educated lady whose field primarily focuses on the control of infections. She is taking a look at what we're doing in public health. She's taking a look at what we're doing in the inpatient world, and she's taking a look at what we're doing in long-term care facilities. And it may be that with her expertise and with her connections back at the CDC, we may learn that there's some ways that we can do things more efficiently or more effectively. So this is a very good resource that has been sent to us due in part to the efforts of the Department of Public Health. Another thing that's going on is actually a federal program that is working through the Department of Health. A few days ago, it became known that there were some resources from the federal government that would allow some states and some counties to have some extra personal protection equipment and some extra collection kits to collect specimens that would be tested for COVID-19. So it's a fairly generous supply that was being offered, and on late Thursday afternoon, we learned that Dougherty County would qualify for this program. And it's good news in a variety of ways. On the other hand, it's also a federal program, and we have some very strict guidelines that we have to adhere to. So we will be collecting specimens. We've done a small pilot program this weekend, and we will be ready to go live tomorrow. We anticipate, with good weather, that we can probably do somewhere in the neighborhood of 100 collections per day for several weeks if necessary. This will be one of those drive-through arrangements, and if weather were to get really bad and if we had lightning and that sort of thing, we would have to postpone or cancel for that day. I really want to stress to you that this program is only open to people in three categories. One would include first responders, and the next one would be healthcare workers who have routine contact with patients of any kind. And then the next category would be people who are 65 years of older who have fever and respiratory tract symptoms. Those are the only three categories that we can collect for testing. And again, it's not a local or a district or a state requirement. This is a federal requirement, and in order to receive these resources, we have to adhere to this. We have a phone line that's available as of 1 o'clock this afternoon, and the number to call there is 229-352-6567, 352-6567, and starting this afternoon, that line is open. It will be open Monday through Friday going forward, all day long. And when people call, it will probably be a fairly short screening process, but we will have to first determine if the caller fits in one of these categories. And if not, then with regret, we would have to tell you that because of the federal guidelines, we could not include you in this testing program. One of the things that we feel like spells out a benefit for this community is we received not only the kits to collect specimens, but we also received the personal protection equipment, thousands of sets of this. So if we're doing tests through public health, then hopefully that's going to take away some of the burn rate of the personal protection equipment that might be being used by the hospital or some of the other folks in town. Those are precious commodities at this time. And so the personal protection equipment that we're using will not have any negative effect on the personal protection equipment that's available for Phoebe Putney or the medical practices in town. In that way, it's a boost of resources to our county. It is very important that we continue to practice social distancing. That is possibly the most important one thing that we can do now to slow this virus down. And we have talked a great deal about how important it is to slow it down so that we don't overwhelm our healthcare facility. It's great to see that most people are following the recommendations. If we could just get everyone else in the community on board, it's going to help us a great deal. It's very important to stay home if you are sick and call your provider to get advice on what the next step should be. Frequent and thorough hand washing are very important, especially if you are in close proximity to the elderly and those with serious chronic medical problems. Very important to cover your coughs and your sneezes, and very important to decontaminate surfaces as often as would be appropriate with household bleach or any number of other approved solutions. Information is very important. Knowledge is power. And in this day and time, good knowledge is really at our fingertips in most cases. There are great websites, and none better, I don't think, than the CDC. They have great information. It evolves appropriately as more information is gathered. It is written in terms that the average person can understand. The Department of Public Health, the Georgia Department of Public Health also has a great website. The Southwest Georgia Public Health District has a website with good information on COVID-19. And for those who are maybe not tech savvy, or they don't have access to the internet, or maybe they would just rather talk with someone, folks in the Southwest Georgia Health District can call their local health department and have most of their concerns addressed. And if that's not the case, then those concerns will be pushed on up to the district, and we will do our best to get an accurate answer in a timely manner. And we thank you very much for your cooperation.
Thank you, Dr. Ruiz. One final speaker today at our press conference is Barbara Rivera Holmes, who is the President and CEO of the Albany Area Chamber of Commerce.
Good afternoon, Barbara Rivera Holmes, President and CEO of the Albany Area Chamber of Commerce. You know, what's different about the things that we're facing today are that we can't really see them. And so what our health professionals are tasked with, our medical professionals, our public officials, are managing a situation that for the most part seems invisible. The people that are affected, that are sick, and that have been identified, they're visible. The people that have been identified, though, were infected a week ago and are just now becoming visible to our medical professionals. So I want the public to know that this task force is absolutely weighing every measure to ensure public health and to mitigate, to the extent that is possible, continued disruptions on our social life and on our economy. In the past, we've had natural disasters, and we've seen the trees down, we've seen the homes impacted, we've seen the social disruption visibly that happens, and we can't see that today. Our only tool right now to combat virus is social distancing, and that's a hard thing for us because we are very much social people and we're accustomed to operating in a certain way. The measures that are in place, I'm so proud of our business community for having put so many proactive steps to protect their workforce, protect the public health, and protect their businesses. And they are finding incredible, innovative ways to continue to deliver essential goods and services to our citizens and to our partners. And I encourage all of our businesses to continue to heed the public orders so that we can get through this situation faster, so that we can get to a period where we can reestablish the daily routines that we so appreciate, and so that we can get back to business as usual. It's difficult, and I'll say this, I'm a citizen of this community. I relate with what we're going through. I have a husband whose business is impacted. I have a 7-year-old who misses her schoolmates. She's traded in time on the playground with her friends to having picnics in the yard with our dog. We're doing online instruction. We're doing arts and crafts, but it's different. We're doing virtual play dates, which is very different for kids. So this impacts everyone, but it's so important that we do this so that we do not have to take stricter measures. As you have heard, the resources on our medical community they're at the point of being tapped. And we just cannot continue to allow that to happen. So I continue to encourage the public and our businesses to take the steps. I know everyone is very active and aware of what those are. Our regional communities, we are calling on you to partner with us to also combat this collectively. Our city and county partners will convene all of our regional elected and governmental agencies. The Albany Area Chamber is taking the lead on convening all of our regional chambers in this area so that together we can approach this in a systematic and collective way as we move forward. Albany is a center of industry, of education, of retail, of medical services, and we live symbiotically. We have people coming in and out, and we really like that normally for the most part. And so we have to work collectively if we're going to get through this. I am so proud of our medical professionals. I'm proud of our IT companies who have really had to step up to ensure that so many others of our businesses are able to continue to function in their essential capacities. The businesses that will be impacted by the new order, many have already taken these measures, and they will continue to find creative ways to deliver goods and services so that commerce can continue to flow. I am completely and overwhelmingly in gratitude to our medical professionals, to the people who are in this fight daily. Our task force is looking at every angle. So we must continue to do what's right. And sometimes it's just hard. That's the social distancing I know is hard. Please continue to follow the orders so we can get back to life, so that we can get back to the commerce that we so enjoy. We will continue to keep you updated. There are many resources already available to businesses that are impacted. The Albany Area Chamber's dedicated COVID Resource Center at albanyga.com has information about the SBA disaster loans that have been activated, has information about emergency unemployment for displaced and impacted workers, and numerous other resources to help business through this and plan for a recovery further down the road. Utilize those resources. Utilize us on Facebook as well, where we're providing even more up-to-date information, and continue to support each other in our business community through a very dynamic and difficult time. We remain committed to our community, to doing what's right for business, and to working with our public partners to mitigate the virus and to minimize the long-term economic impact.
Thank you, Ms. Holmes. As we bring our press conference today to a close, we want to again remind everyone, for information, you may call the Emergency Operations Center at 302-1900. That's 302-1900 for information on resources and information that you've heard today, explaining and understanding the ordinance, whether or not my business should be open. Those are not, again, reasons to call 911. So please forward those questions, even questions about whether or not you should be tested or not. That is not a call for 911. We've given out a lot of information here today, but in the future, as we go forward, today, later today, or into the week, the Emergency Operations Center is open every day from 8 to 5 to answer questions that you may have on those issues. So please, let's funnel those questions through the Emergency Operations Center and not overload our 911 system. So thank you very much, and we will be back tomorrow at 1 p.m. for our daily press conference. Have a great day.